what advice would you like to give pregnant women to minimize morning sickness?
Morning sickness happens very frequently in the first few weeks of pregnancy, and with a certain tricks, I think you could just minimize your morning sickness. And the common thing that I advise is distribute your food intake into 3 main meals and 3 snacks. That means eat a small portion of food every 2.5 hours, and try and include all colors in your diet. That way you would never go wrong with your diet. And you need to finish your dinner early. So, you see, the reason is in pregnancy, especially when the pregnancy starts, your body's energies are being diverted to your heart, your blood, your kidneys and others. So digestion takes a back seat. So what happens is, food remains in your system for a long time, and if you have had a dinner late at your usual time, probably the next day morning you will be more uncomfortable. So have your dinner early, say by 7:30 you finish it, and if you sleep very late, by 10-11 you could have a small snack. And early morning the next day when you get up, you should try and have something solid before you take in liquids. Say before you have your cup of tea or your nimbu pani, probably you could have half a banana or a chiku or half an apple, whatever you feel like having. That could also minimize your morning sickness. And also WHO recommends that ginger is a very effective antidote for morning sickness. So have a small piece of ginger. You could just grate it and squeeze out a few drops of juice from it, and probably just have it in your tea or have it with honey, either way. So ginger juice is also very effective for morning sickness. And plus, of course, if nothing else helps, those medicines that we advise for morning sickness are also totally safe, so you could just rely on them as well if nothing else works.